Hello, it's Dr. Sujana Chandrasekhar again. I hope you're doing well. I've been off the air for a little bit, and I'll explain why in a second. May is Better Hearing and Speech Month, and you'll see another video about that later. But May is also Mental Health Awareness Month. And the reason I've been off the air is that I have been doing some grieving. COVID-19 is a terrible disease when it affects that 20% of its victims with severe disease. And unfortunately, I have been grieving for 3 close people who passed away recently from this disease. And that got me to thinking, how is our mental state now? We've been in lockdown or quarantine in much of the country for about 2 months. It feels like an eternity. People are talking about the stages of grief and of death and dying as defined by Dr. Elizabeth Kubler-Ross. She talks about these 5 stages of denial, anger, depression, bargaining, and acceptance. And it's really for the act of accepting one's own death and dying, but that has been used to talk about grieving all over, and it's not a single way that you get from one to the other, and you go backwards and forwards and you skip steps and you come back. Unfortunately, being sad and grieving is a very complex process. Fortunately, there are many opportunities and resources that can be used to help you if you're going through the grieving. Talking about it primarily with somebody whom you care about and who cares about you is the most important thing. I'll tell you, when I'm looking back at how I have reacted personally to the COVID pandemic, the first thing I got was a great deal of anxiety. It immediately reminded me of the early stages of the HIV/AIDS epidemic in the United States, and we didn't quite know how you got the disease, and we didn't have any solution for it. And as physicians in particular, our job is to make you better. That's what we want to do. And the fear at the onset of this was that we didn't understand it and we weren't making people better. And as these 2 months have transpired, and as several months around the world have transpired of knowledge, we are learning more and more how to prevent the disease from spreading, how to identify early cases, and in some ways how to treat the more complicated cases, the more sick patients. I think being home all the time is really difficult for people. We are human and we like interaction, and I think acknowledging all of that, trying to interact, whether it's electronically like through Zoom meetings or putting on a mask and going out and staying 6 to 8 feet apart from the person you're meeting with and just talking with them, or walking 6 feet apart from someone you like to walk with and having a conversation through your masks. These are really important aspects of recovery. And for those of you who are alone, quarantined alone, even if you are the aloof type of person, that can be super lonely too. And I think it's really important that you reach out and that your friends and family reach out. We're going to get past this, not if we bury our head in the sand, not if we just suddenly open all the doors and take off our masks and just cuddle up next to each other in bars or restaurants, but if we actually use some science, maintain some distance, do some contact tracing, which our governments can do if they're given the opportunity, I think we can get back to a really healthy, good life. And I hope that you agree too. So stay safe, wear your mask, wash your hands, stay distant, only physically, stay connected emotionally, and let's get through this together.